We are 8 months into the COVID-19 pandemic, and some interesting developments are coming out. In this video, let's talk about an alarming trend that is tying social determinants of health, medical coding, and COVID-19. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've helped hundreds of students become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Subscribe to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. In the United States, we are beginning to identify some alarming trends as a result of the COVID-19 pandemic. For example, we have heard about the inequalities of healthcare on various populations. One such trend is the increase in food insecurity. But before we get deeper into food insecurity, let me ask if you are interested in medical coding. If you are interested in getting medical coding education and training, and if you are interested in information regarding our online medical coding course, well, let me invite you to an online live Q&A information session, Saturday, October 31st at 10 a.m. Eastern Standard Time. To register, see details in the description box, and check this out. Are you confused about all the medical coding programs, but unsure what to ask? Do you want to make sure you get everything you need to learn medical coding and become certified? Well, join me on the last Saturday of every month at 10 a.m. Eastern Standard Time, where I will answer your burning questions regarding medical coding. Join our monthly medical coding course Q&A session. To join us, click the link to register.
Can't wait to see you.
So what is food insecurity? The dictionary tells us that food insecurity is the state of being without reliable access to a sufficient quantity of affordable, nutritious food. Another definition from the United States Department of Agriculture, or USDA's report on measuring food scarcity in the United States, is a disruption in food intake or eating patterns because of lack of money and other resources. Another related term is food desert, and it is defined by the dictionary as an urban area in which it is difficult to buy affordable or good quality fresh food. Due to the restrictions related to the COVID-19 pandemic, people have been impacted in a variety of ways. One such way is due to unemployment and people not being able to work in their respective fields or industries due to business closures. With unemployment, you have limited money and resources. With limited resources, you are not able to buy and supply food and or quality food. See the cycle? The HEROES Act, introduced and sponsored by Representative Nita Lowry of New York, will allow for several nutrition and food assistance programs to be funded until September 30th, 2021. So stay tuned for details on that. This, of course, will go a long way and help hopefully suppress some of the food insecurity that is on the rise. Well, how do we know that food insecurity is on the rise? Well, one way is looking at the data that is obtained from the social determinants of health. I've talked about that. Check out this video on social determinants of health. Specifically, coding data. ICD-10-CM code Z59.4 is lack of adequate food and safe drinking water. When hospitals and providers are adding this code to the encounters that they have with patients, then we can easily see the data and quantify it to know that indeed food insecurity is on the rise. But the problem, of course, is that not everyone is reporting the social determinants of health. An even greater problem is, what do you do with the knowledge from the data obtained? According to a recent survey done by the RAC Monitor, 54% of the respondents did not know if their organization had a program in place to address food insecurity. 25% of the respondents said they do have a program in place, and 21% of the respondents said that they do not. So this is just another example of the importance of medical coding as it relates to data, public health, and the social determinants of health, particularly during a pandemic. You have learned that due to COVID-19, food insecurities are on the rise. You have also learned that there is an ICD-10 code for food insecurities. And lastly, you have learned that I am hosting a live Q&A information session on October 31st at 10 a.m. Eastern Standard Time. Questions of the day. Before today, were you familiar with the ICD-10 code for food insecurity? Also, were you aware of what food insecurity means? Let me know in the comments below. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in more information on these tips and others on how to become a certified marketable medical coder, well, check out these videos and check this out.
Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.
If you liked the information in this video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or question. You can also give me a little love by sharing this video on your social media platforms. Let's stay connected and connect others. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.